Hello, my name is Auguste Fortin. Today I'm going to be presenting a model of doctor-patient communication that should make virtually all your encounters more effective and more efficient. The model I'm going to talk about today was developed by Robert Smith at Michigan State University. This model has been shown in at least one randomized controlled trial to be very effective and very efficient in getting the benefits of patient-centered interviewing. Let me show you how an encounter would play out using this model. Like any encounter, it begins with a beginning, where we greet the patient, set the stage and generate the agenda, and then use patient-centered skills to draw out the patient's story in their own words. We then transition to the middle of the interview, where we use doctor-centered interviewing skills to generate the routine database that we need, remembering to always return to patient-centered skills if needed. We then continue the encounter with the physical exam and end with patient education and counseling. In the beginning, we use patient-centered skills to draw out psychosocial and symptom data. In the middle, we use doctor-centered skills to draw out symptom, but also important psychosocial data. Our job is to integrate these two stories into a unified biopsychosocial story. I'd like to walk you through what an encounter would look like with a patient using this model. Hello. Dina Ward?
Yes.
Hi, I'm Dr. Fortin. It's nice to meet you.
Nice to meet you.
I'm one of the medicine residents here at Yale New Haven on the team that's going to be caring for you in the hospital.
Okay.
The emergency room doctors gave me a call and said that you were being admitted to treat your pneumonia. So, you comfortable here right now?
Mm-hmm.
Okay. So step one is really quite quick. I introduced myself by name, used the patient's name and welcomed her. I took a quick look. There are no barriers to communication. We're both speaking the same language and she seems relatively comfortable. And I hopefully presented a warm persona to put her at ease and create the stage for the next part of the interview, which is step two. So what I'd like to do as a member of the team is ask you a lot of questions, find out what brought you here, and examine you and come up with a plan for helping to treat you. Does that sound okay?
Sure.
So I understand from the emergency room records that you were coming in with a pneumonia. Was there something else that also caused you to come in today?
Basically, because I noticed that I was coughing up blood.
Okay. Was there something else other than that?
No.
All right, great. So in the inpatient setting, step two is very quick. There usually is just one issue or a couple issues that are actually medically related. So now we're ready to move on to step three.